So at this meeting, we've seen several presentations showing that the immune checkpoint inhibitors are active in mesothelioma. This is a disease, especially one of the trials showed treatment after failure of chemotherapy, where we really have no good treatment, and there was a relatively good response rate, but probably more importantly, fairly long progression-free survival. And we expect with further follow-up, we're going to see the tail of the curve elevation that we see in non-small cell, where patients who are treated with this, and some of those long-term follow-ups now, we have at 3 years, 26% of people still alive, and in another one we have, again, 5 years, it's about 25%. So again, not huge studies, but very encouraging, and we think the same thing is going to play out in mesothelioma. Small cell too, we're starting to see there's evidence of activity. The question of is what's the best way to use it? Is it a combination of 2 immune checkpoint inhibitors? We saw data with that, which also was pretty promising today in terms of progression-free survival and also response, with the doublet being a CTLA-4 inhibitor and a PD-1 inhibitor together being a little bit better, but the PD-1 alone was fairly good. So side effects are a little more with the combination. So somebody who's maybe in not such good shape, you might use a single PD-1 inhibitor, others you might use a combination, but it looks like it's going to give us something to do for these patients. We've had no improvement for the treatment of extensive stage small cell, and some people say 30 years, I'm actually going to say 40, because the first time that the combination of cisplatin and etoposide was shown to work in small cell was back in 1978, and was done at Sloan Kettering and published by one of their fellows. And since then, people have tried to improve on that, and nobody's been able to do it. So now we've got hope that this is going to change.